Okay, good morning, everyone. Welcome to the Drug Testing Standards and Practices Committee. My name is Duncan Patterson. I'm chairman of the Delaware Racing Commission and chairman of this committee. What I'd like to do initially is ask the members to introduce themselves so everybody in the audience knows, can put a face to the name. I'll start with you, Dr. Palmer.
Dr. Palmer. I'm Lynn Harvey from Minnesota.
Corinne Sweeney, Pennsylvania Racing Commission, Horse Racing Commission.
John Wayne, Delaware Thoroughbred Racing Commission.
Charlie Gardner, Kansas State Racing Commission.
Rick Goodell, New York Gaming Commission with Dr. Palmer.
John Ward, Kentucky Racing Commission.
Frank Zanzuki, New Jersey Racing Commission.
Mike Hopkins, Maryland Racing Commission.
Thank you. I just want to remind the audience the process. We're obviously going to be talking about Cobalt, Carolina Gold, GABA, and a proposal from Rick Goodell. The first order of business is Cobalt, and I asked Dr. Benson to come up and make the presentation on behalf of the RMTC. Thank you. You ready?
Yes.
Okay. The floor is yours.
Thank you. Good morning. Just going to cover a little bit of background information on Cobalt, as well as some of the information and research that we've done. It's on.
It's on.
Some of the information and research that we've done in the last year regarding this substance. So just to give you some background, cobalt is an essential mineral. It's endogenous. In other words, we cannot treat it like a medication. The presence of cobalt alone is not a violation because it's naturally found in the horse. It's also contained in vitamin B12 minerals, which is a common additive to vitamin jugs. And it's also contained in a number of other substances that are used in the normal course of training in horses as supplements. It's important to note at the outset that there has never been a reported cobalt deficiency in the horse. So in other words, there is not truly a need to supplement these animals. The purported use is to increase performance through erythropoiesis, or the creation of red blood cells. We've done a single-dose study, and that dose showed that there was no change in the erythropoietin. In other words, it didn't actually cause an increase in red blood cell production as reflected in an increase in erythropoietin. Additionally, the KHRC did a multiple-dose study, and there was also no change in erythropoietin. So basically, we cannot show that it works the way that we thought it did. It doesn't mean it doesn't work. It's just that we don't have a parameter to show that it actually increases red blood cell production. What we are concerned about is the health and welfare of the horse. And we've seen in human literature and literature from other species that there's concerns about gastrointestinal, thyroid, myocardial, neural sensory toxicity. And these have been reported in both high-dose and low chronic dose administrations. Now, additionally, in the KERC administration study, doses were used that were commonly reported by veterinarians as being used on the backside of the racetrack. When these doses were administered to racehorses, we saw sweating, colic, muscle fasciculations. Those were observed. If you would like to watch the videos, they're available on our website at that link. I can certainly play one of them for you right now if you'd like. They are pretty dramatic, so it is certainly a health concern. So what have we done? So I referenced the administration study that was done in the University of California, Davis. In a published paper, Dr. Knitsch administered 109 milligrams of cobalt chloride, and we found that in plasma there is an extended half-life for cobalt of 156.4 hours on average, so about 5 to 6 days. Now, if you contrast that with urine, the half-life in urine is much shorter, about 4 hours. So last July, I was addressing the Model Rules Committee, and we were talking about the research that we had done in early 2014. And what we had gathered were regulatory and research samples from 4 laboratories. There were 521 samples, including thoroughbreds, quarter horses, and standardbreds. Many were post-race samples. In other words, these were horses that we had no idea of their Cobalt administration status. Based on that information, the range was between the limit of detection, which is 1 part per billion, and 388.2 parts per billion. The majority fell below 2 parts per billion, and by far the vast majority fell below 14 parts per billion. Just to give you an idea, one of the challenges with Cobalt is it doesn't have a normal distribution. In other words, if you look at the diagram on the right, that's a normal distribution curve, what we consider to be the bell-shaped curve. If you compare what we found the best fit for serum cobalt in our early data on the left, you can see there's obviously a skew of the data to the right with a long or to the left with a long tail of the data to the right. So it doesn't really fit a straight analysis like we have done. So based on that and the concerns that were raised, as well as a concern that there was another study going on that was that we'd been requested to review the information for, we went back and got more samples. So at that point, we collected samples from 2 laboratories in 3 jurisdictions, and we amassed a total of 1,203 new samples. So this doesn't include the 500 samples that were originally taken. And we focused on these 3 jurisdictions because they had put in some sort of regulatory control, be it Indiana, that enacted a 25 part per billion threshold, California, that said they were going to put horses on the vets list above 25, or Kentucky, and all they did was tell trainers that they were looking for this in out-of-competition samples. Based on those samples, you can see there's a good distribution among the breeds, and the range that we had in this case was between 1 part per billion and 88.9 part per billion. Again, we don't have... This could reflect horses that had been treated with cobalt. But we did find 46.5% of these horses were below 2 parts per billion, and 96.9 were below 14 parts per billion. These are the histograms. The histogram on the left shows the occurrence of data, of the normal data, or the raw data, in blood in the 1,203 samples. The histogram on the right is the log transform data. In other words, you can transform data to try and make it more normal, and certainly the log transform data is slightly more normal, but it's still not perfect. And just to compare, this is data from California that shows their distribution of data of samples prior to the enaction of the 25 part per billion vets list requirement. And compared that to after they'd enacted a 25 part per billion threshold, you can see there's a significant decrease in the variability of the horse-by-horse data. So ultimately, the Scientific Advisory Committee met in February and came up with a 2-tier recommendation. The Scientific Advisory Committee felt it was important to have a 2-tier recommendation because there are supplements that can affect, that are traditionally used in horse racing that can affect the cobalt level in a horse or cobalt concentration in a horse. They felt that between 25 parts per billion and 50 parts per billion, there should be a warning or a minimal fine for a first-time offense, and the horse should go on the vets list. With a long half-life, this can take, if a horse is just above, it can take days or up to a week or more. And then horses above 50, they recommended a Class B penalty with a fine, disqualification, trainer suspension, and that the horse remain on the vets list until it's below 25 with retesting at the owner's expense. So again, why the 2-tier recommendation? It's because in a number of vitamin mineral preparations, cobalt is normally present. It has a long elimination and half-life. So if someone is at 100, they are not going to be below 25 in a week. It's going to take them several weeks to get below 25 parts per billion. They felt that it was important to do this because in some of the high-dose cobalt products, there's the possibility for it to bioaccumulate under unusual dosing regimens. It's a stupidity penalty, is essentially what the Scientific Advisory Committee called it. Now, keeping in mind there isn't a need to actually administer cobalt or cobalt chloride or even cobalt salts of any type because no horses are deficient. It's not, even taking away the ability to administer some of these supplements would not affect the horse's health. Horses above 50 parts per billion, the consensus here was that someone would need to be grossly negligent or intent on using cobalt inappropriately. In other words, the administering of cobalt salts. And they felt that a Class 3 Category B penalty would provide meaningful sanctions to discourage people to try and titrate. Now, we've also looked at some other possible thresholds because there have been different suggestions made for what kind of threshold should be appropriate for cobalt. This slide shows you, based on Dr. Knich's administration data, how many horses would be penalized under each threshold at each time point. So in other words, at 24 hours, 25, 35, and 50 parts per billion would catch all of the horses. If you use a 70 part per billion based on 100 milligram administration of cobalt chloride, only 12 of the 16 would be shown to be above that threshold. And as you can see, at 168 hours, none of those would be. But using a 25 part per billion threshold, 11 of the 16 horses would still be above a 25 part per billion threshold. So in other words, in order to have a threshold that enables you to prevent low dose or chronic administration of cobalt salts, 25 parts per billion is a recommended threshold. This recommendation passed the Scientific Advisory Committee unanimously. It was also referred to a biostatistician and an epidemiologist to review the data. Just to give you a comparison, based on the late 2014 numbers, if we do the 95-95 tolerance interval, which is what we usually do for medications, the number came out to 10.04. And the mean plus 3.72 standard deviations, which is the more common use for endogenous substances, came out to 22.72. Now, admittedly, this data is not normally distributed, so this is extrapolating a little bit on the numbers, but if anything, these numbers are skewed high because we have horses in there that could probably be excluded based on the distance that they are from the mean. So again, there were two statistical issues brought to the forefront with cobalt. How do we analyze non-parametric or non-normally distributed data? IFHA was traditionally used on data transformation techniques on normal populations. And how do we deal with data from horses that are obviously manipulated? We were able to contact and have a conference call with a biostatistician from Penn and a epidemiologist from UC Davis, and they felt that the treatment of this data was appropriate based on the numbers, and they were comfortable with the numbers that we obtained based upon this data. That is all I have. I'm happy to answer any questions.
Thank you, Dion. I think what we'll do is, actually, I'll entertain questions from the committee. I want to emphasize one thing for the benefit of everyone. We are focusing on the health and welfare of the horse. We're not taking into consideration the performance-enhancing product of cobalt. But the studies really have determined at certain levels that it is deleterious to the health and welfare of the horse. Do you have any comments on that, Dion, before I open it up?
I completely agree, because we've not been able to show that there is a performance-enhancing effect. That certainly should not limit the ability to protect the health and welfare of the horse.
Okay, I'll open up for comments and questions from the committee. Lynn?
Dr. Benson. Dr. Benson, I just want to be very clear on this. If you were not able to see a rise in erythropoietin, does that signify that it is not necessarily a blood doping agent, but may have other performance-enhancing effects that you don't know yet?
Agreed, yes. And, you certainly can look at other blood parameters like hematocrit, but in the horse, hematocrit isn't a very reliable measure of blood doping because they have such a large spleen. The hematocrit varies widely in and of itself, so looking at something like that would be inappropriate.
I just wanted to be clear on this because originally the thought process based on human information was that it was a blood doping agent.
Right, exactly. What we'd seen originally with humans, this is not translated into horses, is it was originally used in humans in individuals with renal failure to increase red blood cell production, and we haven't seen that same translation into the horse. But that doesn't mean that it doesn't have other effects. We certainly have anecdotal reports from trainers who believe that it does and from veterinarians who believe that it does. We just haven't found that mechanism, so it's impossible for us to base a recommendation on that.
Any other questions, comments from the committee?
Okay, quick. Mike? One quick question as far as because of the welfare part of this issue and the fact that the research isn't done yet or it's been attempted to do as far as any effect on the animal performance of the horse. Is the RMTC going to continue down that path to try and make that determination at some point?
I don't know that we will. I think that what we have seen in the states that have enacted this kind of a threshold, Indiana, California, it has effectively controlled the use of cobalt. So absent a reason, or if we continue to see horses that are high in the hundreds, and there is really no reason to do that. I mean, I don't know if you saw the data from Indiana, but their really high numbers virtually disappeared with just a 25 heart per billion regulation.
Frank?
Dr. Benson, can you explain how the RMTC came to the recommendation of a Class B penalty for this substance?
Sure. The RMTC based it upon the fact that they wanted something that would deter the use of cobalt. So in other words, a mere fine or a warning at that 50 part per billion, they didn't feel would be adequate. They wanted something that was strong enough to deter an individual from trying to titrate the dose. And of course, the 10-year penalty that has been recommended by this board in blood doping case for blood doping agents, we couldn't support because this hasn't been shown to be a blood doping agent. So we couldn't use the severe A penalty as a recommendation. Therefore, we went with the substances. It's endogenous. You can get increased levels by normal supplementation. So it was really a balancing act of what's reasonable and what will control the problem.
My only concern was if there is no known reported case of a horse that is cobalt deficient, then why should it be in the horse at any level? And if the threshold levels that are being proposed would clearly indicate that an administration of cobalt has been given to this horse, obviously, in my mind, that was done for a purpose. And I was... by my way of thinking, I thought that maybe a Class A penalty would be more appropriate.
Well, to give you a comparison, this puts it on the same level as anabolic steroids.
That's what, Doc?
Anabolic steroids?
What dose causes a health risk to the horse?
I don't know that we've done that research. I mean, we've certainly seen at a 1.5 gram dose, we've seen colic and things like that. But the issue isn't what dose causes a problem, it's what level is appropriately found in the horse. So if we exceed the level that's appropriately found in the horse, then you run the risk of chronic or long-term health risks for long-term administration.
I guess to follow up on your answer, what concentrations would document that there's an injury to the horse?
I don't think we know that.
Yeah, said another way, if there was, or not said another way, but it would seem that with proper education of horse trainers, they would actually, if they're wise, they would say, I shouldn't use this. There's no proven advantage. In fact, there's definitely proven disadvantage to my horse. There's no deficiency. So it's just as our chairman said, this is really a health issue. That, why use it? Back to your point, is making it a more severe penalty. It falls into some of these endogenous products, right? That's why I think the research supports, or what you reported supports your recommendations, Orsi. In that you may have this range because you are not trying to hurt your horse, you're not trying to dope the horse, but you still use some supplements. Yeah, so it's really a health issue.
To be clear, the use of supplements like a vitamin B jug, red cell, those kinds of things have not been shown to raise the level to anywhere near the 25 part per billion. And that's not what we're looking at. There's one product called Vita 15 that, if used every 4 days long term, can raise the level of cobalt above 25. It hasn't been shown to go above 50. But that being said, it's a matter of educating horsemen and veterinarians to say this product may not be your best option.
Yeah, I was thinking, if I wanted to cheat, I'd say, okay, I'm going to pass on this, I'm going to look elsewhere. Because this is one that probably won't help and it may hurt.
Right.
Dr. Benson, for the benefit of the audience and those people who have not seen those films, which I found very disturbing. I know you said it's familiar to colic, but do you have those on the... I think it shows really the terrible effect on a horse that's been given for excess cobalt, and underscores our need to move forward on this.
Save them from themselves. Mm-hmm. That's why it's the stupidity.
So there were 3 horses that were administered cobalt at the Kentucky Equine, at KER in Kentucky. This was under an IACUC, so it was a university-approved administration. And as you can see, this is not a hot day. This horse was administered cobalt chloride, and this is the result. This horse was sweating. I don't know if you can see their muscle fasciculations. It's obviously uncomfortable. So these are certainly concerns that we have in seeing administrations. And keep in mind, this was at the level that was told to us by veterinarians that was being administered at the racetrack.
And what was that level?
They said it was about 1.5 to 2 grams total. And I've got another video which I can show quickly that will show you. So this horse, again, and these were repeated administrations, and the effects were repeated, so it wasn't a one-time situation. This horse was administered cobalt also, and you'll see that he has signs of colic. He's pawing. He eventually will lay down and look at his belly. So basic discomfort on the horse's part, but for certain.
Dr. Benson, did you have to treat these horses with anything to address these signs, or did they resolve spontaneously?
My understanding is they resolved themselves.
How long did it take for that to happen?
That I don't know. These are Dr. Scalay's videos, but I don't know how long exactly it took for these symptoms to subside.
Well, would you repeat Dr. Palmer's question?
Sure. Dr. Palmer was just wondering how long the symptoms lasted in each horse.
And the answer would be treated.
And if they needed to be treated, yes. So my understanding is they were not treated, but...
Any other questions for Dr. Benson?
Yes, I have one. Dr. Benson, in all the time we've been talking about cobalt, has anybody come forward to say that we're making a mistake in regulating cobalt? Has anybody said it needs to be a part of the daily regime, that it needs to be part of a horse's health program? I mean, has the HPPN or anybody stepped forward to say that they need this product to help their horses?
At our board, the only vote that did not, there was an abstention, but the only vote that did not support this was one from the Jockey Club, and the only reason they did not is because they felt the threshold should be lower. So the THA supported it. My recollection is the HBPA supported it. So I don't think that there's any question that there's a belief that cobalt should be regulated.
If you, Mr. Chairman, is there anybody in the audience that wants to stand up and defend cobalt?
John, what we thought we would do is have Dr. Robertson make a presentation on behalf of the RCI Scientific Advisory Committee, and then I would open it up.
Sure. Well, I was just asking that question. I didn't want to get a debate going here.
I have two other questions for you. Where will these proposed levels, the RMTC levels, put us in line on an international basis? And where are you with publications, scientific publications? Because as you know, that's an important issue for the racing regulatory veterinarians.
So taking the second question first, the paper that was completed by Dr. Knitsch is actually already published.
Okay.
So that has already been published. It's available online. I'm not sure if it's actually been published in the journal, but it's available online. It's been through peer review.
And you would be able to send that to the racing regulatory veterinarians if they ask for it?
Absolutely. Absolutely. And then the first question with regard to international. So internationally, there is circulating among the IFHA Advisory Committee, there is a proposal for 100 parts per billion in urine in a post-race sample. Now, that is, if you look at Dr. Knitsch's research and compare the time at which a horse passes below 25 parts per billion in plasma and 100 parts per billion in urine, they are roughly equivalent. So we'd be very close to that 100 part per billion. The other threshold that is being looked at is in plasma, an international plasma threshold that is being looked at by Hong Kong. And I actually had the pleasure of talking to Dr. Wan yesterday about this. And we're really dealing with two different populations of cobalt. In Hong Kong, they take what's called free cobalt, so cobalt that's not bound to albumin, any proteins. So it's just the free cobalt in blood. What we've looked at in the methodology that we've used in the United States in the labs that we've worked with is a total cobalt method. So our number is going to be inherently higher. When we were speaking yesterday, Dr. Wan said he believed that the 25 part per billion is roughly equivalent to about a 10 part per billion of free cobalt, which is roughly where they are probably going to end up. So it would put us right in line with international recommendations.
Thank you.
Mr. Chairman? Yes, Charlie. Dr. Benson, I'd like to ask you just your opinion on this. If in a jurisdiction 200 random samples were run and only 2 of those samples came up over the 25 parts per billion threshold, would you believe that that jurisdiction had a cobalt issue?
I would believe that it depends on how far above 25. And I will tell you, so what we've seen...
Significantly over 25.
Then I would say you've got a trainer or a group of people who are using cobalt.
Okay, thank you.
What we've seen largely, for example, in Arkansas, they tested for cobalt at 25 parts per billion, and their positives came from 2 trainers. I mean, this isn't a widespread issue. It's certainly individual trainers, and it's not as if there's a horse in this barn and a horse in this barn that has a problem. It's a trainer-centered.
Right, and thank you for that. My other comment, and I don't know if it's appropriate at this time to talk about penalties, but I just want to throw this out there for thought. First of all, we are not scientifically sure that, if I'm hearing you correctly, that cobalt has this blood doping effect. Correct. Is that correct? We are not sure.
Correct.
Number 2, we are also not sure that it has a performance-enhancing effect?
Correct.
Okay. Number 2. If it did, assuming that it had a blood doping effect that we could prove scientifically, and that it had a performance-enhancing effect that we could prove scientifically, then we could associate it with erythropoietin or the administrations of erythropoietin. Would that be correct?
It would not be, it would be more similar. You could treat it more similarly to that.
Okay. And in my jurisdiction, and I believe in other jurisdictions, the treatment of EPO was that if the horse tested positive for the antibodies of EPO, then we would take that horse out of competition until such time as it did not have the reaction to the antibodies to EPO. But there was no direct penalty nor fine to the trainer. It was just take the horse out of competition. When he tests below at the trainer's or owner's expense, then we would let the horse back into competition. Then why would we vote for a Class A or B penalty that would kind of equate it to an anabolic steroid, which we know all of the effects that it has? It seems to me that until we can prove that it has a performance-enhancing effect, that it has a scientific blood doping effect, then would we be better served by taking that animal out of competition until such time, as opposed to a Class B or a Class A penalty that would be very, very severe to the trainer?
I would caution against that just because there are many Class A's and Class B's that we've not ever put into a horse to prove that they have a performance effect or a health effect. Now, what we've said is we can't prove that this has a blood doping effect, but by that logic, you could say that anything that hasn't been proven to have an effect should just put the horse on the vet's list. And the other thing is if you think about it from another point of view, if a trainer has a really big race coming up, there is no disincentive to have that horse on the shelf after. So that can certainly be a motivating factor for a person who's not worried about the best interest of the horse.
Thank you.
Okay, I'll take one more question, then we ask Dr. Robinson to come up.
Long question, so I can get both my questions. What concentration was produced in the horses that were given the doses that caused those effects?
Those were above 1,000 to start. So, but keep in mind, a couple of weeks later, they would have been lower. So if you have a horse that's racing every 3 to 5 weeks.
Yeah, I appreciate it. Just quickly, please.
Can you exclude that overdosing a horse with cobalt might improve the performance of the horse?
Absolutely.
Or is it just not yet proven to a certain level?
We looked at very minimal pharmacodynamic factors. We didn't do any exercise tests, anything like that. We've certainly seen from anecdotal reports around the country that people believe that it does have an effect. We just haven't tied it to a specific effect.
Great. Thank you, Dr. Benson. I'd like to call on Dr. Robinson, who will make a report and recommendations from the Scientific Review Advisory Group from RCI.
Good morning. This report will be fairly short because we had our first meeting yesterday.
Bring the microphone a little closer to you if you could. Thank you.
Can you hear me? Can you hear me now?
That's it.
Good morning, everybody. So we had our first meeting of the ARCI Scientific Advisory Committee on Tuesday from 4 to about 6. It's the first time that we were able to sit down, and we were asked to discuss cobalt. And just so everybody is aware, I also am a member of the RMTC Scientific Advisory Committee, so I was included in those discussions in February. What I'm going to present to you is what my impression of our discussion was at that meeting. I would also like to allow you to invite other members of that meeting to come forward after I'm finished in case my impression of what our collective consciousness was is not correct. So we discussed many of the things that Dr. Benson presented to you, and so I'm not going to go ahead and rehash all of the introductory material. I think one of probably one of the areas where there has been some discussion among the different groups has been the population studies and the determinants of that threshold value and how that was determined. So there have been several studies that were performed that were, some of which were shared with the RMTC and some of which were not. The RMTC study and a study that we did in Pennsylvania, which looked at 500 horses, 250 thoroughbreds, 250 standardbreds. These were post-race samples. In that population, as Dr. Benson had mentioned, we had our statistician analyze those samples, and then we had a conference call between our statistician and the epidemiologist who analyzed the RMTC data to try and determine why there were some differences in the results of our analysis. And the primary difference was that the threshold value that we came up with from our analysis was at about 50 parts per billion versus the 25. There were significant differences in the levels that were found in the different regions. Our highest level that we recorded was 1,420 parts per billion in a racing horse. There were several others that were right around 1,000. And those were not found in the population that the RMTC had studied in those post-race samples. So it was clear to us in Pennsylvania that we do have a cobalt problem. We have some horses that had some very high levels, and that's a problem. And so the biggest contention, I think, between the different groups has been, well, how do we take this data, which is not normalized, and how do we analyze it? And then also, how do we interpret that data, knowing that there are horses in that group that received these bulk cobalt salts? I mean, that's really what it comes down to. And the other point I'd like to make as a pharmacologist is that we have no idea what dose these horses have received. So we know that they received some dose of cobalt, whether it was through a supplement or through a bulk salt, but we don't know when, we don't know how much, and all we have is a single time point, essentially data from a single time point. So it's really makes it very difficult to draw conclusions as to, well, how much was given. You cannot draw conclusions as to how much was given, when it was given, from a single data point like that. The bottom line from that discussion, however, was that at the end of the day, when we all sat down and said, well, what about this 50 parts per billion? Is that an appropriate threshold to begin penalizing above? At that point, it comes down to the unpublished data that we've done using supplements. And this data also was presented to the RMTC Scientific Advisory Committee and was included in the thought process as to setting this threshold. In Pennsylvania, we've administered quite a few supplements, including 10% sweet feed, 2 pounds of 10% sweet feed, red cell, vitamin B12. We've done a vitamin jug, a common vitamin jug that's used by veterinarians, and then this product called Vita 15, which contained the highest amount of cobalt of any of the products that we've been looking at. When you administer any of those products as a single dose, a single administration, according to how it's labeled on the product, we did not see concentrations go above 13 parts per billion in the plasma. The 13 parts per billion concentration was for the Vita 15 product, which, as I mentioned, had the highest amount of cobalt in it. We did not see any change in the plasma cobalt concentration for the sweet feed or the red cell or the vitamin B12 or the vitamin jug. So none of those products actually changed plasma cobalt concentrations. We could see a small increase in the urine for a very short period of time, but no changes in the plasma from those other products. So that left us with this Vita 15 product, which was the one that we knew was out there, we knew people were using, and we decided to do some further study on that product. specifically, we wanted to know, well, what happens if someone gives it according to the label, which says to give it twice a week. And we know that cobalt has a very long half-life because we have the benefit of Dr. Kanish's study. And we were all concerned about accumulation of this product. If someone's giving it twice a week, the maximum we saw was 13 parts per billion, and then it dropped down to about 7 parts per billion at 24 hours. But what happens if you give that biweekly? So that's the study that we are currently finishing up. I only have partial data from those horses. That data was not available at the RMTC Scientific Advisory Committee meeting. And from the partial data that we have, all of those values were below the 50 parts per billion threshold that has been proposed as a cutoff point for penalizing horses. There were two that looked to be possibly outliers. There was one that was 46 and one at 34. They were in the middle of the dosing regimen, which doesn't really make a lot of sense. It's not like we're accumulating up to that value. It's just that all of a sudden there was a high one. And so we have to follow up on those. And that's the nature of a scientific study. It's not perfect. We don't know what we're going to have until we complete the study. And so that study is actually being finished up today. The last dose is being given today, and then the samples will be collected and analyzed, and we'll be processing that data as soon as possible. That said, it does seem that it is consistent with the mathematical simulations that we've performed based on the single administration of that supplement. So once you have those kinetic parameters, you can basically do forecasting to see if you follow that out, what type of accumulation you would expect to see. And so far, the results are consistent with our forecasting, which all fall under the 50 parts per million threshold. So that's at that level. By using that supplement, the data from our supplement administrations, and actually, before I go on, Dr. Adam Chambers' group in Ontario has also done. They've also administered several different supplements. The one where they saw the highest dose was from something called Iron Power. I believe that's correct. And that dose, correct me if I'm wrong, Adam, but I think it was at 5 minutes you saw 22 parts per billion, and at 24 hours out, I think it was about 16 parts per billion. Is that correct? Sorry, it's not my study. I'm not as familiar with the data. That's correct. So,
is that a one-time administration, or did that one go on?
That was administered for 14 days. So, again, we may not be at steady state with that 14-day administration because the half-life is so long for cobalt. That may not be at what we pharmacologists call steady state, where after you give a product that's accumulating, if you give it for a long enough time, eventually you're going to get to a point where the amount that is removed by the horse is equal to the amount that's being put back in. And so you reach this steady state concentrations where you have a maximum value and a minimum value. You oscillate between those two values. So we don't know in that study whether that was at steady state or not. The data that I've seen from our study, the preliminary data that we have, it does look like we achieved steady state within that 5 week. It was a 5-week administration protocol, giving it twice a week. So that supplement data suggests that this 50 parts per billion threshold is a relatively safe threshold, that anything above that you can be more reasonably assured has been due to over cobalt salt administration and not due to feed differences in feed or due to some sort of supplement that's available over the counter. We were then asked whether there was a concentration above which we would be comfortable with sanctioning a much higher penalty, so something like a 10-year suspension or something like that. And it's something that I don't think any of us have really, I'm sure Dr. Malin had considered it because he's faced it in New York, but the rest of us had not considered that level prior, or not considered that question prior to this meeting. I know that when we looked at our population data, we looked at it two different ways. The first way was let's just include everybody, even though we know the horses that have a 1,420 parts per billion level are way out of line from everybody else. If we include everybody, what does it look like? And that looked at, if you do the calculations with those data included, we ended up with a threshold of 66 parts per billion. If you then take the data and say, okay, let's look at 10 times the median was 5 parts per billion. Anything that's 10 times over the median, which is a cutoff of 500 parts per billion, let's throw those out as outliers. That was 5 horses in our data set. And then we do the calculations, and that's when we came up with a threshold of 46 parts per billion. So, it's not, I have to say it's really arbitrary. It depends on how you think about that data and where you want to make that cutoff. We don't have scientific data to support at what level there is a toxic effect, or certainly we don't have any data that support at what level it's actually going to have a blood doping effect. There is a paper that was performed it's a review actually of the literature in humans and in other species and the effects of cobalt on those species, which states that at 300 parts per billion, that's the cutoff. You need a concentration of 300 parts per billion or higher for a 2-week period in order to have an increase in red blood cell production. And so that number, that 300 parts per billion, was brought up as being a potentially good cutoff to use in horses. That said, then you're extrapolating from data that's been produced in humans and other species, and we know, from other drugs, other substances, that anytime you extrapolate across species, you really have no clue what that means in the species of interest. It can give you a rough idea, and sometimes it's valid, but we really don't know without doing the study. The one other point I think that I would like to make is that we really don't have a lot of published data in this case. I mean, we have Dr. Knich's study, which is fantastic. We have the study from Hong Kong, which Dr. Benson explained is not relevant for the plasma data, and that study is not relevant for us because we use different methodology. That's really the extent of what we have that's published at this point in time. There is a lot of unpublished data that we've used to come up with these recommendations. The population studies that were done through RMTC, and the population study that we did in Pennsylvania, and the population study that Dr. Malin did in New York, none of those studies have been published yet, and we're all trying to use that unpublished data to try and give you a recommendation. And I do think that is valid in this case, because we know we have a problem. We know we have horses that have these 1,000+ parts per billion concentrations, and that's a post-race sample. So assuming your security is good and the horse didn't get the drug right before the race, we know that horse got a very high concentration of cobalt at some period of time before that race, which could have had these toxic effects. Dr. Chambers also shared with us that the blood concentration, when they were performing similar studies and looking at 2 grams of intravenous cobalt administration, was about 10,000 parts per billion. So it is a very high level that you need to have these toxic effects. But the post-race samples that we're analyzing, we're not taking them 5 minutes after they've been given cobalt chloride. We're getting them 24 hours, 48 hours, 72 hours, who knows, maybe a week later. It doesn't tell us whether that horse had toxic effects or not. We can't use that information to tell us that. All we know is that horse got bulk cobalt salts. And what we've been told by the veterinarians that are out there practicing is that people are giving these salts to a toxic effect. They think that when they see a toxic effect, that means it's working. And so if we are seeing an elevated cobalt concentration, then I think it is highly suspect that that horse did have a welfare, a toxic effect, and it is a welfare issue. So at this point in time, I think the ARCI Scientific Committee, at least from my perspective, at the end of that meeting, we all did somewhat agree that a 50 parts per billion threshold is an appropriate threshold to begin penalizing above. There were some of us that thought a 300 parts per billion threshold may be an appropriate threshold to begin sanctioning severe penalties above that level. And then I think there was some confusion. I sent out a document and asked for feedback, and some of us thought that the 25 was a good thing, and some of us thought that the 25 was not. My opinion is that between 25 and 50, issuing a warning and putting them on the vets list is an appropriate action. Because again, like I said, that's our only data point. We don't know whether that horse received bulk salts or supplements, but it's possible that they could have received the bulk salts and been exposed to those, to having effects such as you saw in the video.
Okay, Dr. Robertson, the bottom line of this is that your committee supported the RMTC recommendation. Is that correct?
I believe that's correct, but as I said, I would like to open it up to other members to come forward if they would like to.
What was the vote on this, as you recall?
The vote was everybody in the room said okay.
And for the benefit of everyone, how many people were in the room?
So that included Dr. Malin, Dr. McKeever, Dr. Tobin, myself. Dr. Stanley was still in the room, and I know he supports that threshold as well, and Dr. Chambers. So there are 6 of us.
Mr. Chairman,
Ed was there.
I was there. Well, I didn't vote, believe me.
No.
I don't vote on this kind of stuff. I facilitated the meeting, and it was a little testy over the availability and use of data. And that has been an issue that's been discussed at RCI meetings prior, and that is, to the extent possible, it's preferable for a government regulatory agency in the formation of government policy to rely as much as possible on publicly transparent information. That being said, there was a bit of a tug-of-war in the room about who was going to share what data, and at the end of the day, there wasn't a whole lot of data that had been shared. We did request from the RMTC as much detailed information, including data, as possible, but it was their decision as to what to submit. And there was no... some of the data that was used to make that recommendation was not submitted. I think it is... I don't recall a discussion in the committee between at what point you put a horse on a vet's list. We did focus the discussion on what point do you actually start to impose regulatory penalties, a fine or a suspension. And the vote on that, as according to my notes, was unanimous at 50 parts per billion. There was an extensive discussion about is it possible, because of the equine welfare issues that have been brought to light, and we've just seen that on the video that we have seen, that there is an administration of a substance that has been given to a horse, not for any medical reason or recuperative purpose, and you have deliberately put that horse in distress and caused that horse possibly pain or triggered another potential ailment. And there was a discussion as to at what point should you stop treating, or can you legitimately hang your hat on a level at which point, and I'm not an attorney, and I'll defer to attorneys in this room, but at what point you could defend that if you went to a more serious penalty, such as what New York does as a prohibited substance, and treating it the same as a prohibited substance. There's many of our members that I've discussed this with felt that 15 days for deliberately putting a horse in distress is inadequate. So that was the question that was asked to the committee, and the committee voted 4-1 in favor of 300 parts per billion based upon the study that Dr. Robinson has referenced. According to my notes, the one dissenting vote was Dr. Stanley, and that was based on the fact that was not applicable to horses. But I'm just a layman. What I kind of gather from a lot of these discussions is we're doing the best we can with the science that we have, and we're struggling with this one because it is endogenous, because there is a tremendous a belief that it can be used to affect performance and is being used to affect performance, or at least intended to be used to affect performance. And we are seeing, although we're seeing anecdotal videos that cannot be discounted, because in these particular horses, you're certainly, a deliberate administration has caused a horse to go into tremendous distress. And if somebody does something to a horse that puts a horse in distress, and it's not for a medical purpose, there's a sense that might warrant a pretty severe penalty. If I misstated any of that, somebody who was in that room with me could articulate that as well.
Yeah. Now open up to questions from the committee. Rick, we'll start with you. What do you want to go to Corinne first? Or
I just wanted to...
ladies first.
Thank you. I'll say clarify if I heard this correctly. Earlier on in the presentation, you mentioned the different level of cobalt and the different sample studies, the RMTC studies and the Pennsylvania studies. And to be clear, they were different blood samples. They weren't different test results from the same blood samples.
That's correct. No, the laboratory that we use is Dr. Lisa Murphy's toxicology laboratory at New Bolton Center, and she participated in the United States ring test, which was the test used to ensure that all of the tests in the United States were measuring cobalt the same way and coming up with the same values.
I just want to make sure that it's clear, so it wasn't different test results.
No.
And so it was really a different population. The result in a different population.
Correct.
Thank you.
Could you review for me again how you came up with the level of 300? I am distressed because, as you know, you cannot extrapolate equine data from human data. And you can't extrapolate equine data from dog data, nor can you extrapolate cat data from dog data. So I am distressed that you're using human data to find that level, and I'd like to hear again how you exactly came up with that and what is the scientific basis for it.
So that level was proposed by Dr. Malin based on that study. For myself, I'm comfortable with that level because of the supplement work that we've done. So I'm sure that those supplements are not causing a level higher than that. That's it. It's really for me. And I think it's not based on scientific fact, as you are aware. It's an impression based on the reasonability of the data, the possibility that somebody accidentally administered something to get a 300 or over level, I think is not possible. But that's based on an impression. It's not based on a scientific evaluation or any type of study.
Rick? The two horses in your study, they had the 46 and the 34 in the middle of your time?
Yes.
Were they at a normal level at the outset of your study?
Yeah. Let me clarify. So these horses they're part of our research herd. They had normal levels at the beginning of the study before any Vita-15 was administered. They were then administered Vita-15 twice a week, so on Monday and Thursday, for a 5-week period. The 36 value, 34 was found after the 4th dose, and so we're looking at what's called a trough level. So essentially you give a dose, you then wait until it's time to give the next dose, and you take a sample right before you give that next dose. You want to know what amount of that substance is still there right before you give the next dose. And so after the 4th dose, the trough level in that horse was 34. The other trough levels surrounding that number were, after subsequent doses, were 22, 14, 15, 12, and 16. And so it certainly seems to be an outlier in that individual horse, and we'll have to follow up on that.
Did you say there was one that was a 46?
The 46 was after the 7th dose, and so we don't have, and that horse has not finished the study until this week, so I don't have the data yet for that horse.
And how many horses were there?
There's 6 total.
How long could you find a concentration of, how long would a concentration that was 1,000 or more still be at a level of, or a concentration of 300 or more? I mean, I know that you can't say exactly, but you've been working with these models showing accumulation and half-life.
I'm not sure I understand.
In other words, if a horse were administered a dose that caused it to have this serious distress.
10,000 parts per billion, yes.
Yeah, and if the concentration was higher than 1,000 in that horse.
Okay.
How many, roughly speaking, how many days later would it still be above 300?
We'd have to do the math.
I mean, would it be the next day? Would it be the next week? Or?
So if the half-life is 1 week,
Okay.
then you would, and you have a level of 1,000, then after a week goes by, you would expect the level to be 500, right?
So 14 days later, maybe 250.
Yeah.
Doesn't work that way. Next 30 days, I guess.
Any other questions, comments from the committee? Charlie? No, I'm sorry. I think Dr.
I have a couple of questions, Mary. One of them is, I actually have a couple of questions. One of them relates to the issue of the welfare aspect, and the other relates to the 50, in terms of the threshold versus the 25. And it seems to me, I want to try to clearly understand what you guys came up with, that your belief is that by using Vita 15, for example, you can get above 25, between 25 and 50, by administering that in a legal fashion to a racehorse if you follow the recommendations of the manufacturer over a period of time. Is that correct?
That's correct.
Okay, so my interpretation would be that if someone was using that product, as long as it was legal in the jurisdiction, which is, to my knowledge, is that they could have a false positive. They'd be very likely to get a false positive if they administer it on a regular basis. Is that accurate?
I guess it depends on what you mean by a false positive. Do you mean above the 50 or above the 25?
Let's say
above the 25, absolutely.
Yeah, but not at 50.
I don't believe so, but again, that's the study that we're finishing up.
Okay, no, that's fair. The other thing that I'm troubled with, or I'm having a difficulty putting my hands around, really, is that the issue of what do the thresholds mean, the other numbers mean. You know, I think we have a regulatory need, clearly, to regulate cobalt. There's nobody disagrees with that. We also have the challenge of saying, well, you know, can you get in trouble by doing something that's legal? That can be addressed perhaps by the 50, perhaps. The one thing that troubles me more, though, is we're talking about a welfare issue, and it doesn't seem to me that we have any data, accurate data, to indicate that that's happened or hasn't happened, other than to say, well, if you have a high number, then somewhere along the line that horse must have been really high, and that would have perhaps, you know, caused a welfare incident as we saw here. Is that fair to say that?
I think that's the assumption, yes.
Okay. So in my own mind, then, I'm thinking to myself, well, let's forget about the 50 and even the low numbers, and maybe even over to 100 or so, but do you have a number? Forget the Finley study, and I understand the challenges of going across species things. I mean, it's a guideline. Yep. It's a guideline. But it's not a hard fact that shows that would happen in a horse. But can you put your finger on a number? I mean, let's just say, you know, the other challenge we're facing is we're trying to stop the manipulation of horses in the perception that they believe their intent is to manipulate their athletic performance. Whether it happens or not, or how it happens, let's just say perhaps it happens, but we're not sure how. That's pretty accurate, I think. So at what level would you say would indicate significance? I mean, 300 is an interesting number. Is it 500? Is it 1,000? Is it 200? Is it 100? I really don't know. But I mean, at some level, the regulators are looking for a breakpoint that says we are convinced, based on this number, that you are intentionally trying to manipulate this horse's athletic performance by administering cobalt. Am I clear? Do you understand where I'm going with that? Is that a question you can answer with the data that you have, is what I'm saying? Okay, no. So
let me try to rephrase the question to make sure I understand the question. Sure. So the question, I believe, is that do we have enough data to be able to come up with a solid number above which we can say a person is intentionally administering cobalt in order to try and do blood doping?
Exactly.
Is that the question?
That's the question.
And I think that number is 50, is the answer.
Okay.
I think that number is 50. Based on the data that we have, I think that number is 50. Below 50, you're in a situation where the person could have been giving cobalt salts, but they could have been giving a supplement. And they could have been doing it legally, as we've talked about. And so we don't know below that level. Anybody giving a bulk cobalt salt to get them above 50, it's illegal. It's not approved. It's not an approved product. You're buying it from a chemical company. You're mixing it up in a bag out in your truck, and then you're shooting it in the horse. There's no sterility. There's no it's not a pharmaceutical preparation. That's an illegal administration of cobalt. And I think based on all of the data that we have, 50 is the number at this point in time.
Is it possible we could get an opinion from other people in your committee about that
Absolutely.
number for that purpose?
Absolutely.
Regulatory purpose.
And that's why I said when I came up, I'm not sure that I'm really representing the committee as a whole, because we didn't have enough time to fully discuss and come up with a summary document that we all agreed on. So I wanted to make sure that was clear at the outset, and that you felt free to invite other members of the committee up.
What we'll do is see if anybody has any more questions of you, and then we'll invite, I see Dr. Tobin there, and any other from the Dr. Miller. Dr. Miller. Stanley's there too. Okay. Charlie.
Dr. Robinson, as a defense attorney, if I'm defending a trainer, given all of the statements that have been made today, I think that I could, before a jury, make a very strong case that my client would be acquitted or found not guilty. But if I put on my executive director hat, I need to ask you a few questions. It says here that you work for the Pennsylvania Equine Testing and Racing Laboratory. Is that correct?
I am the acting director for the Pennsylvania Equine Toxicology and Research Laboratory, yes.
So you do testing for jurisdictions?
We do testing for Pennsylvania.
Pennsylvania. So if a jurisdiction, Pennsylvania, were to say today, we believe that we want to start testing every sample for cobalt, and we'd like you to do that testing for us, what would be the cost of that testing, and how would it increase a jurisdiction's budget?
It depends on the approach that you take and how many samples you would like to test. If you're going to test every sample,
yes.
We test about 1,000 samples per week in the summer. For the particular laboratory that we use,
yes.
It's $22 per sample.
$22 extra per sample?
Yes, okay. But that's an in-state cost. Out-of-state cost, if you were going to submit samples to that laboratory, would be higher. I don't know the cost.
And do you believe that there could be effective testing with doing less than every sample?
I believe it would be a deterrent, yes. I think that the goal should be to test every sample, but I do think that in the interim period, we could provide enough of a
deterrent effect.
Yes.
And this is probably what we're all trying to accomplish.
And if I may, in addition, the alternative to submitting samples to another laboratory that already has the instrumentation is to purchase the instrumentation yourself. The instrumentation is around $200,000. And so as you can do the math, we would gain that cost back very quickly.
Thank you, Doc.
Well, this is certainly a very important topic. We really do need to move along, so I would invite other members of that committee to come up, but I would urge them to be fairly brief in their comments, if that's possible. And since I spotted Dr. Tobin first, I'll ask him to come forward.
Well, Mr. Chairman, in the interest of time, I mean, you've got a pretty full agenda, and you now have 45 minutes to go through this agenda. And it's been a lengthy process by which we've gotten to the recommendation here. There's a disagreement on the GABA recommendation, and at that point in time you will have competing scientific views, but you do have a recommendation from the RMTC that is consistent with the majority recommendation, the full recommendation with regard to 50 parts per billion of the RCI Scientific Advisory Committee. The issue that's was a 4-to-1 vote, had to deal with, is there a level at which we should hang our hats for a much tougher penalty? And that's going to go to a proposal that Mr. Goodell has to put before the committee that is going to take some time to discuss. But it would seem to me that you've got pretty much agreement on 50 parts per billion for the beginning of regulatory sanctions in terms of we could continue to talk about that for the next 45 minutes, in which case we will not get to other issues we need to get to. So I would ask you to take a vote on the 50 parts or defer or let Mr. Goodell put his proposal on the table.
Yes, I think Mr. Goodell's proposal will be a part of our overall proposal. So, Rick, if you can make your proposal, and thank you, Ed, for saving me from myself.
I'm just the guy that has to keep the trains moving on time.
So clarifying, you're separating out those two recommendations, is that correct?
I think you need to hear.
You have to hear the proposal.
I think you need to hear Mr. Goodell's proposal.
Rick, why don't you give the genesis of what you're proposing?
Actually, Dr. Palmer and I were working for a long time on a draft of the Asmussen report and looking at how California had dealt with their thyroxine issue with Mr. Baffert a few years ago. We considered the idea of a proposal that would just broadly prohibit the excessive administration of any substance. Steve, if you scroll down to number 2, the rule is number 2 there, just that no substance may be excessively administered to a horse. It would just be a violation of all of our rules at all times if that happened. If you don't mind going back up again, Steve. So to be an over-administration, we looked first of all at over-administration, which would be D since it's alphabetical order. An over-administration would just be the administration of some substance at a higher amount than would be consistent with accepted veterinary practices or necessary for the health and welfare of the horse. So it's more than the horse needs by any normal standard. That would not be a violation. There are many things that are over-administered that don't really matter. To be a violation, there would have to be what we defined as an excessive administration, which is B. So this would be an over-administration that either hurt the horse, could endanger its health and welfare based on the dose, or it's a substance whose nature is that over-administering it can produce abnormal changes in the performance of the horse. Cobalt, in theory at least, is an example of that. And there are many other substances that, if you overdose the horse with them, beyond veterinary practices, beyond what's good for the horse's health, you may produce an abnormal effect on racing performance. So the idea was that shouldn't we just have a sort of a global rule that would make it illegal, not just to use cobalt if it falls into this category, but any number of other substances that there's no reason to be using them on the horse, and they can either hurt the horse or abnormally affect its performance. And the other thing is that we looked at the concept of having 2 levels of penalty. One of them relates to the discussion today of a level of 25 and 50 for cobalt, which would be a clear indication that there had been an excessive administration of this drug. In the case of, for a normal violation, this is, again, just a concept, open for discussion, but we include, the proposal concludes a Class B penalty simply for having too much of these types of substances in the horse. But it also has a gross violation, and for the gross violation, there would be a 10-year minimum suspension. It would be the same as prohibited substances like EPO. That's a definition of the gross violation. An egregious deviation from the standards of acceptable care, whether from one dose or multiple use. And it would also occur whenever we could demonstrate that the excessive administration of the substance would have had the abnormal effect, would have been a blood doping agent, for example, would have actually done that. And that relates to the discussion we've had today of whether 300 is an adequate proxy for that in the absence of any horse data at this time. If you go down a little farther, Steve. We would provide the trainer or other responsible person with an affirmative defense. So the horse person would always have the right to appear in front of the commission and attempt to demonstrate that the actual administration, as documented by contemporaneous records, did not endanger the health of the horse or its welfare and did not cause an abnormal effect. This is, I think, important for legal reasons. It's very difficult to argue in court that we would not even consider this type of information. This type of information might not be readily available for a trainer, for example, to use, but at least they have a legal right to use that information if they can acquire it. Those are the penalties. As I mentioned before, obviously subject to discussion, but a simple violation. Part of our feeling for a B violation was that for substances that have a long half-life, preventing the horse from racing for a long time could be a very substantial penalty in and of itself. You might have a horse at a 3, if someone's horse was at 1,000, as Dr. Robinson gave us a rough idea of this morning. A week later, it might be 500. It might be a long time before it's below 50. Even a 250 would be several weeks before. Anyways, you get the point that a horse might be unable to race for a very long time, and under those circumstances where we're very confident that something was either grossly negligent or intentionally done wrong, it warrants a trainer penalty. The gross violation, again, those are situations where we believe it's comparable to EPO. In New York, we announced that we were enforcing in harness racing, where we had the rule, our prohibited substances rule, whose language is broad enough to include any substance that abnormally oxygenates a horse, with a minimum 10-year suspension, and that's an effective deterrent. I don't think we were having levels over 1,000 at one of our harness tracks repeatedly, but not anymore. If you go down, then we thought that it would strengthen the rule and be easier for horse persons to follow it if we gave some examples of substances, and those are listed here, that might fall within that category of a substance that either is going to hurt the horse if you give an over-administration or have an abnormal effect on racing ability. And then finally, number 6 would be where we could have thresholds that would, we would conclude, would establish these violations. So that's where Cobalt appears, whether the excessive administration is determined by 25, 50, or some other level. That would be a basic violation. And then secondly, the excessive administration, now there's apparently some support, fairly tentative, but some support for 300 based on other animal studies. I put those in brackets because the purpose of this rule proposal is not the Cobalt threshold, but just to consider having this kind of an approach. If you went, don't bother to do this, Steve, but if you went back to the definition of gross violation and you applied it, for example, to 300 for Cobalt, that would incorporate the approach that Dr. Robinson expressed, which was that she, whether there was any scientific basis for concluding that that really was a level at which the horse's racing ability would be affected. It certainly is so substantially higher that it would be fair to draw a very strong inference from the laboratory results that a person may have endangered the health of the horse with the administration, and also may have affected its racing ability. And even if it didn't, there would be no reason to do it. And it's very strong proof that someone had done this, attempted to do this. So there are different legal bases to support a higher penalty at that particular threshold. That's the gist of the idea.
Mr. Chairman, when Mr. Goodell first ran this concept past me, I was kind of froze in my tracks. I didn't know what to say. Because it kind of was a different approach here, as it basically turns the tables on if somebody gave something to a horse, you may get called in front of the commission and have to explain what you did and tell us and prove to us that what you did not endanger the health and well-being of that horse or affect performance. The more I thought about this, the more I kind of warmed up to it, because one of the things we're struggling with, and we're here today, and Cobalt has been being used at our racetracks for, we can't exactly tell you for how long. There's certainly been reports that, it takes us a while to get all the research done to be able to tackle the problem, and you can't get out in front of some of these problems. And the more I thought about this proposal that Mr. Goodell has put forward, this is a way to possibly get out in front of these problems. And as you heard a rather lengthy discussion about what science there is and what science there may not be for various levels and so forth, and after sitting through a 2-hour meeting the other day that frankly could have gone 2 months and not necessarily reached a different recommendation or conclusion, people, once they know you're testing of some things, they move on to the next thing. So the concept of a regulatory rule that would be all-encompassing, dealing with excess administrations and providing a serious penalty for a significant departure from acceptable veterinary practice, might be a very important sea change for this industry to protect our horses from people who are just pumping things into them and not have any idea what it might do to that horse. So I would urge the committee to give very serious consideration. If you were to embrace this concept, it would go out for public comment, and I'm sure the exact language would be chewed on by lawyers all over the country, and that input would be important before any policy would be adopted, at least a model rule would be adopted by this association. So I would urge you to give serious consideration to this, because I think it could be a very important sea change to protect horses from people giving them things that they have no idea what's going on.
Okay, I'll entertain questions or comments from the committee.
Mr. Chairman, I've been looking at this proposal. I read it last night. It is a novel approach. It's very different. I think it does warrant more review as far as the committee is concerned. There may be a very good basis for it. I think where we need to be cautious here, I think personally, is that when you start looking at just the way the definitions are created in gross negligence, I don't disagree with the concept, but I think we have to define more of what we're talking about here before you start creating rules like this.
Charlie? I'm almost wanting to ask Rick if he stole some of this concept from Louisiana, because it's not really Rick, I'm just kidding. But in our Category 4s and 5 drugs, therapeutic drug violations, we created a matrix in Louisiana where we have severity of violation and numbers of violations in a calendar year. And I would also just throw this out there that instead of starting with a extraordinary violation, we divided ours into an ordinary violation, because there are going to be some errors and then our second category was an extraordinary, and then a gross violation, depending on the level of the drug. So I would just urge the committee to also consider that instead of jumping to an extraordinary violation with a Class B penalty, that we also include an ordinary violation with a rather mild penalty.
Let me ask the kind of informal question to the committee whether they embrace this concept. Obviously, we couldn't at this point be prepared to move it on to model rules, but to get the process moving, how do you feel about Rick's proposal?
John Randall. I think it's a step in the right direction. I know that if I found out that someone had given any kind of substance to make a horse be in distress, I would make it my personal goal to minimize their participation in my jurisdiction.
Thank you, John. Ricky, you did have a comment.
Yeah, I just wanted to follow up on what Mike said. This is not a final draft necessarily, and so I would suggest that we focus on just the concept of a basic violation and a gross violation. The language that I used on here for the gross violation, I swiped from cases in New York in which medical doctors were sanctioned by their boards and removed from practice. And the language was that when the court found that there was an egregious deviation from the standards of acceptable medical care, those doctors not only were subject to money damages for ordinary negligence, but were sanctioned and removed from the licensing. So that language certainly could be improved, or certainly should be re-examined as you suggest. So I would focus more on the point of the idea of a gross violation versus an ordinary.
Well, obviously, we want to use HPPN and PHA, but we're not prepared to do that now because of time restraints. But you want to do a motion or not, or just a consensus that we embrace this concept?
I make a motion that the committee consider further review of this and submit it to the various horsemen's organizations for comment, because they're the ones who will be affected by it, and other regulatory bodies.
Okay. We have a motion second?
Second.
Well, we can have a motion second and entertain comments. So we have a motion and a second. Further comments?
Rick, I like the proposal. I've seen it used in tax law in Canada, this gross negligence proposal or concept. I think it works well. I like Charlie's idea of looking at a sort of a three-tier, a really low basic penalty, something mid-range, and then a big hammer that for a big number you get hit really hard. I like that concept. Just maybe one comment with respect to the definition of gross violation. I think maybe we may want to look at adding the horse welfare in there as well. But I'm all for the concept.
I have a question, Mr. Chairman. Now I'm taking time and I've gotten an evil eye from the chairman. Just had a quick question for Rick.
It's back at you.
On this approach, Rick, one of the things that we've heard, especially as we've talked about the regulation of cobalt, is that some jurisdictions have done some cobalt testing and have an extremely high level of cobalt, and they've not been able to basically take regulatory action because they did not have a specific rule for that substance on the books. If you had a generic regulatory approach like this, even for substances, and you have language in this that is kind of catch-all, and in terms of the next cobalt, would this regulatory rule approach enable those jurisdictions to basically act?
Yeah, I think for forever, as the racing commissions, we sort of reacted while people participating in horse racing have tried homeopathic, any number of substance administrations that really aren't about veterinary care for the horse. It's all about the racing ability of the horse, and to get an edge, and many times we don't even have a test for it. We might not even know it's being used yet. And rather, reacting one by one, usually after the fact, and often just in time to watch people move on to the next substance of abuse. But the purpose of this rule would be just to say that's not permissible in horse racing anymore. You can't just give excessive administrations of substances that
What is excessive?
that serve no good purpose whatever, indefensible. So this, as you say, would be a general rule that would make it illegal from this point forward, no matter what the substance.
Corinne, I'll take yours, and then we obviously have to move on to...
I certainly support the concept. I mean, you go through the words when I read it last night and read it today, and you're nodding, and they're words, but the key point is going to be that level. It's going to be that number at the end, and we just want to make sure whatever that number is, as example for the violation or gross violation, that number is scientifically defensible. That's to me the bottom line, because these words make sense. They're words. It's going to be the number. We just want to make sure it's proper and defensible and scientifically defensible.
Thank you. Well, we have a motion on the board basically is to embrace this concept, put it out for comment to the organizations that would be impacted by this. Entertain a vote. All those in favor signify by saying aye. Aye. Those opposed, same sign. Okay, we're going to go back to our main topic, and that's the thresholds on the Cobalt. Specifically, I'll entertain a motion what was presented by Dr. Robertson on behalf of the RCI Scientific Advisory Committee, 25. Which would be the levels of 25, 50, and 300. 300 being exactly what would be the 300 would be the as far as the penalty is concerned.
Can I amend?
Can we amend that?
The most severe, the 10-year would be...
You want to bundle them all together in one motion?
I would prefer to, unless the committee wishes otherwise. So I'll entertain that motion.
I would prefer that you remove the 300 until you have some scientific evidence. I would be comfortable with the 25 and the 50.
Would you make that motion then?
I would make that motion.
Second?
Second.
Comments?
What you were saying, what was your motion?
Just clarification.
Bring your mic to you a little bit so
My motion was that we remove the 300 with a 10-year penalty until there's some scientific evidence to support that, and we proceed with a level of 25 and 50.
So at 25, between 25 and 50, it would be vetless
And a warning.
and a warning. Over 50 would be Class B penalty.
Correct.
Correct. Is that clarified for everybody? Yeah. Okay. Excuse me?
Well, the thresholds would proceed to the board. The recommendation is to leave Tampa with the board, accepting, at least providing some guidance to the regulatory commissions. With all due respect to the comments that have been made, I would, the proposal, as I understand it, is to accept 25 for vets list and 50 for regulatory action beyond that. I would argue that our scientific advisory committee was 4-1 in favor of a adoption of a higher threshold warranting a more severe penalty, and I would take that as a separate issue, understanding that there are people on the committee that do not agree with that.
Well, the motion we have before does not include that. So, any more clarification, discussion on the motion? Rick?
I mean, I think that it's concerning that Dr. Robinson, using legal medication, was able to, he had horses. Out of 6 horses, she had 2 of them were over 25 during a 3-week period, or 3.5-week period. And so, I mean, I found more persuasive the idea of a 50 as a sanction level, even with a horse. I'm uncomfortable with the idea of disallowing a horse from racing whose horse persons might have done nothing out of the ordinary with the horse. They might just have a horse that pops up as a 46 or a 34 or something.
Okay. Mr. Chairman, the other option to that would be to leave that particular issue to each commission, because some commissions have already adopted that as a policy.
Well, we have a motion in front of us. We're ready to vote on that motion.
Thank you, Mr. Chairman. As far as Lynn making the motion, is it appropriate to offer an amendment to that motion?
If she's accepted, we'll accept it.
Go ahead.
And my amendment would be that, in line with what Ed was raising the issue, that your motion would be that the level for which cobalt becomes a penalty would be 50 parts per, anything above 50 parts per billion, with the fact that anything below that could be individually established by commissions as far as whether or not they want to take any type of sanction as far as a list or non-racing capabilities until they test below a certain level.
I'll second that.
I'm fine with that.
Okay. Does everybody understand the amendment? Now, we're voting on the amendment only. Okay. All those in favor of Mike's amendment to the motion signify by saying aye. Aye. Opposed, same sign. Okay. We'll now vote on the motion as amended. And everybody's clear on that? Okay. All those in favor signify by saying aye. Aye. Opposed, same sign. Thank you.
Mr. Chairman, do you want to take a separate vote on the tougher penalty at 300 parts per billion? And the options for the committee would be to accept 10 years or to leave that undefined and put that out and tie that into what Mr. Goodell's proposal.
Well, if anybody's willing to make that motion, certainly we will entertain it. Is anybody willing to make that motion at this time?
I'll move that we accept 300 as a threshold value at which the much higher sanction will be imposed.
Okay. Second.
Second. I'd like to make an amendment that we also consider revocation.
I think that actually the minimum mandatory is a 10-year suspension, so it does not preclude a revocation.
Okay. So you're comfortable with that? Okay. Okay, we have a motion on the floor. Any other comments, questions? Hearing none.
I just wanted to add some discussion.
The question for me is, do we feel comfortable? We've got a motion we've already recommended that 50 is going to be the point we're going to start sanctioning people. And I'm very comfortable with that. When I asked Mary about what she thought was a number where she could definitely say scientifically that somebody's manipulating a horse, to influence the outcome of the race, she said 50. So it gave me some second thoughts. I was thinking 300, frankly. I was thinking it's a good number to be at. I guess it really boils down to the penalty. That at 50, we're going to be getting Class B, which is significant. And I guess the question I think the committee ought to consider, are we comfortable with that as an adequate deterrent, to accomplish what we want to do in terms of get this stuff out of the sport? And I think that's a more difficult question to answer. I will tell you that in July in New York, we made an announcement that we were testing for cobalt and that we were going to administer a prohibited substance penalty of 10-year suspension for anybody who was found above a threshold that we would not release. We were thinking of a higher number than 50, I can assure you that. But the point being that we did a survey of the horses in the state with Dr. Malin of cobalt levels and came up with about 18, it was about at least 18 was our average parts per billion for the horse population before the announcement was made. After the announcement was made, we did another survey, and the average Cobalt numbers were 0.5. So it was... I would just think we need to just consider what we will accomplish and what it takes to do that. So is the committee comfortable thinking that 50, for example, without a reference to 300, with a class B, keeping in mind we also have our multiple rule violation rules in place in most jurisdictions, and so there would be a cumulative effect if they did this more than once. I mean, is that where we want to go? Or I think that's the thing I'm struggling with right now just a little bit.
Well, certainly that level, if we approve the 300, it could be amended sometime in the future.
Mr. Chairman, I think the issue for the committee, and I understand what Dr. Palmer is saying, and I usually never disagree with Dr. Palmer, but the only thing I would say is the issue is bigger than Cobalt. The issue is what do we feel an appropriate penalty is for somebody who basically does something to a horse that they shouldn't do to the horse and is putting the horse in a level of distress that is not necessary for recuperative or rehabilitation purposes or as part of a medical response to something. And that's an animal welfare issue, and that's the way this issue has been presented to this committee. And if we think, I think the choice is, do you feel that 15 days and $500 fine is sufficient for somebody doing something to a horse? And I realize the science may not be perfect, and I can't argue whether that number 300 is right or wrong, but there is science that is not perfect with regard to performance enhancement. That is, and we're setting thresholds on that, and the best advice from our experts, both at the RMTC and within RCI. But I think this is an important equal.
From what you said, Dr. Palmer, was that it should be lower than the 300. Did I misunderstand you?
Well, no, I guess
I want to share a little bit technically. But I guess my thought would be another way to look at this would be so would anybody at this table have any doubt whatsoever that if we got a 300, that person did it accidentally, did it with supplements, was following the rules, or had any other possible motive than to manipulate the outcome of the race and to over-treat this horse? To me, there's no question about that. Maybe you don't want the number. Maybe you want 200. Maybe you want 103. I mean, is anybody in this room could possibly doubt that if we had that number, that would indicate, an egregious violation of the intent to manipulate the horse and possibly serious health danger? I don't think there's any question about that whatsoever. I mean, I agree with you that we don't have the number to say that does that. But, I mean, how else do you go 300?
Yeah, well, absence anything else, we're at 300 right now, and that was my point. That can always be modified in the future with certain additional scientific evidence. Corinne?
Well, that would be a question. If we say yes, let's go to 300, we know that's where we stop looking to find out whether it really should be 100 or 75 or 200. That would be my concern.
400. I would argue that all our thresholds and all our policies are subject to the latest published science that might give us cause to change them.
No, but here, as you're talking about, Corinne, we don't know what dose actually causes the effect on performance. We don't know what concentration, except from a projection from other species.
Well, that's right. That's right. So if we didn't have that paper, we wouldn't have even had a 300 number, right? So how do we pick 3? So can we look for that number?
We should still look for that number, absolutely. Although, if cobalt disappears from use and something else is the problem of the day, given our limited resources, but the 300 is going to mean that any horse that's treated the way that the video depicts, for 2 weeks, that horse is probably going to be over 300. And so we're going to catch those kinds of things occurring within a couple of weeks at least of race.
With all due respect to the committee, we can go around and around on this, so I'm going to
I'm going to agree. Like I say, it's just as long as a yes vote doesn't mean that, 250 would have been okay.
Certainly.
Okay.
Okay, all those in favor of the motion signify by saying aye. Aye. Opposed, same sign.
Opposed? I'm opposed.
I am.
Okay.
What's the count? What's the count?
It's 3 opposed.
Out of 4.
He asked for 300.
Abstain. Let me have the hands of those opposed again, please. Okay, it's 3.
Who voted for?
Everybody else.
1, 2, 3.
I'm not going to vote twice this time.
You're on the committee.
I know, but I'm not.
So what is it? 1, 2.
It still passes.
4.
It passes.
1 abstention.
Fine. Okay, the motion passes. Thank you. Mr. President, do you want to move right into the GABA?
If we can, I don't think we'll get it done in 10 minutes, but I think if you could give 3 minutes to Dr. Benson and 3 minutes to the Scientific Advisory Committee, and let's understand it quickly, and you can decide what you want to do.
Yeah, we could approve this at a later date telephonically. So, Dr. Benson, would you come forward and make a very brief presentation, if that's at all possible?
I think Dr. Benson should know that the submission from the RMTC was circulated to all the members of the committee. And so, in essence, the materials have been provided to everybody and hopefully have been reviewed.
So, just to be brief, background on GABA, it's a neurotransmitter, it's an inhibitory transmitter. Basically, the way that it works is it decreases the ability of a neuron to fire. And it's another substance which is endogenous to horses. In other words, we can't say the presence of it is per se a violation. The issue we have here is it's been found on race day records of several veterinarians in a number of jurisdictions when they've been confiscated. It's administered about 4 hours prior to racing in violation of the race day administration rule. The purported use is a calmer. We have one published study reviewing the several pharmacodynamic effects, but none of those chosen parameters were statistically different from non-treated horses. Regardless, it is administered on race day, so it really doesn't matter if it has an effect. The USEF did one administration. What they observed was sweating, shaking, and near collapse in the horse. Our GABA data consists of 325 horse samples, again, a mixture of thoroughbred, standardbred, and quarter horses. And these, again, were post-race samples collected absent any regulatory control of GABA. Here again, we have raw data that's not normally distributed. There's the mean and the standard deviation. Again, if we do a 1 in 10,000 probability, you end up with a number of 102.27. The Scientific Advisory Committee came up with a recommendation of 110. The log transform data, which is closer to a normal distribution, gives a threshold of 76 parts per billion. Here's a copy of our data. On the left is the raw data, on the right is the log transform data. GABA recommendation from the Scientific Advisory Committee was 110 nanograms per mil in plasma or blood and be treated as a Class 3 substance with a Category B penalty. All of the members on the SAC voted in favor, with the exception of Dr. Robinson, who abstained based on the fact that she didn't have enough time to look at the information.
Okay, I'll open up for questions from the committee.
Mr. Chairman, this issue was put forward at the Scientific Advisory Group. There was the group did not make a recommendation on this. The group did not have a consensus. There's another point of view, and I can't say whether it was majority of the group or minority of the group, because at that point in time we had gone a long way and we were trying to raise an issue that probably could have taken another 2 hours. The question, I guess, would be whether to hear briefly what the other their point of view is, and then the committee would need a determination whether you want to address this at this meeting or lay it over and do a conference call over the next few weeks and have a lengthier discussion on it.
I would like to hear Dr. Robinson briefly.
Dr. Robinson was not, I think, Dr. Robinson was chosen to speak on the Cobalt issue, and I think Dr. Tobin was delegated to speak on this.
Okay, Dr. Tobin, would you focus on why you're not ready to move forward on this, or why there was a disagreement on it?
I think they have it altered.
Thank you, Chair. Thank you, Chairman Patterson. Members of the committee, we've just had a presentation of a piece of science. There is an already published piece of science, review published in the scientific literature, that arrives at a different conclusion. And the discrepancy has not been addressed in the presentation to you. And that is a significant significant scientific deficit in what you have just heard. Let me briefly review what we came up with. My understanding is that the instruction to the committee was to review the published refereed scientific literature on GABA in the horse with a view to recommending a regulatory threshold. We are aware of two published reports on GABA in the horse, the Knitsch et al. In 2014, which I believe is the reference that Dr. Benson referred to with regard to the lack of pharmacological effect, and there is a report in the International Conference of Racing Analysts and Veterinarians. It was presented in 2012 in Pennsylvania and Philadelphia, and has just recently been published, but the data has been available in the public domain for quite some time, to my knowledge. The Knitsch paper does not propose a regulatory threshold. Our understanding, and this is my understanding as I sit here today, is based on this proposal we've just seen presented is based on so far unpublished scientific work that was not available to us for review. I'm looking at it, and the first question I have is what is the reason for the difference in the mean values between the study that has just been presented and the Malin study? And since there was no methodology presented in this review to you, I cannot begin to answer that question. So basically, we were unable to assess the scientific merits or otherwise of what you have just seen. And to our knowledge, this research has not undergone the peer-reviewed scientific publication process, which would...
What is the difference between the numbers? I hate to do this, Dr. Tolan, but just in the interest of time, Mr. Chairman.
My apologies.
What is the difference between the published study that we're recommending be considered? What is the difference in the numbers?
Yeah. Published study recommended 190. 190 nanograms per ml, which is significantly higher than the study. The data are just a little different, and there's probably an understandable basis for it, but the published study comes in significantly higher.
So you're recommending 190 parts per billion as opposed to 110?
Based on the published scientific literature, the recommendation would have to be 190 because that's what's out there in the published scientific literature.
Is that the recommendation of the Scientific Advisory Committee?
No, it was not. We didn't get that far.
You never made a recommendation. So what you're telling the committee right now is that you're at 190, which is obviously a significant differential from what the RMTC is recommending. So you're basically telling us not to move forward on this at this time. Is that a correct statement?
The published scientific literature is 190, and I was asked to identify what was in the published scientific literature, and that's what we've done.
Okay. Mr. Chairman, the issue of what we published transparent data has been one that's been brought up by various members, various levels of this association. I guess what we have is we have scientists. I guess I'm not really sure at what point the GABA data that was relied upon for the RMTC recommendation, at what point that might be published or might be available. I think the argument in front of the committee is: do you accept published scientific data, or do you accept a recommendation based on non-transparent data? And that goes through larger issues. The other issue could be, do you want to, because for instance we don't have the recommendation in place on GABA, whether you want to adopt an interim pending publication of the RMTC data and give them the opportunity to make it available publicly, or that's one of the issues we would hope to kind of resolve with the RMTC. So that's kind of your choice: public data or non-public data.
Let me ask Dr. Tobin one other question, since she represents the HPPA, and I know there's no empirical data to my question, but do you think that this is just your own opinion? Do you feel that this is a problem now, given that we have the third-party administration?
You're asking me whether it is a pressing regulatory problem at the moment. That's outside my expertise.
Okay, thank you.
Mr. Chairman, may I make a motion that we defer any action on this until we all have time to look at the data more closely?
Is that your motion at this point?
Yes, it is.
Second. Further discussion on the motion. Basically, until we have more data, we're tabling this question. Any other comments?
Comment, I think, we just appointed a new review committee to review the science and to comment on the science, and they haven't apparently had an opportunity to see all the data and look at the methodology and make a comparison between these two studies. So I don't think it's appropriate to ask them for an opinion better right now until they have the opportunity to do that, but perhaps we can do it in a conference call or something like that. But I think I would support a deferral of the matter until we get a better report from that committee.
I agree with you. And just out of curiosity, since you're deeply involved in this day-to-day, based on your current position, would you feel that this problem is not as Dr. Tobin used, as pressing as it was previously?
Well, I think it's out there. So I do think it's important, but I just don't think it's appropriate to make a recommendation without our own committee making an appropriate finding, and they don't have the information to do that. And they should be able to get that information in short order. So I don't see the reason why we can't wait for them to review it and then make a recommendation. We can consider it then.
Okay, thank you. Any other comments, questions? Basically, the motion on the table is to postpone any decision on GABA, Carolina Gold, until such time as we receive more data and information. All those in favor signify by saying aye. Aye. Opposed, same sign. Thank you. Mr. President, do you have anything?
No, I think we've dealt with, we've tried to deal with the two issues we wanted to deal with today. The only thing I would say is I think we will try to expedite maybe consideration of GABA and try to get them to have a discussion so we get some kind of assessment recommendation.
Okay, I want to thank the committee and I entertain a motion to adjourn. So moved. Thanks.
We're giving them 30 days for levels.